ndio mama yake Nuria. Basi vile niko hapa nimekaa hivi, Nuria mwenyewe alianzwa ugonjwa mwaka wa 1927 akiwa na miaka 7. Hapo tulilazwa Kenyatta. Sasa Kenyatta ndio ilikundua kwamba Nuria na sickle cell. Na mimi mwenyewe sikuwa najua. Nilikuwa naona tu mwanangu kama anafura shafu, mikono, miguu, tumbo na hali. Alafu macho inakeuka inakuwa yellow. Sasa kutokea hapo Nuria tuliishi Kenyatta naye mwaka mzima. Sasa hiyo ugonjwa ka affect Nuria. Kwa sasa Nuria hawezi kujielewa. Mambo mengi anasahau. Amekuwa mtoto wa kujisahau. Mpaka amekuwa mlemavu kiakili na kimaumbile yake. Sasa wakati alikuwa shule sikuwa najua kama ana huo ugonjwa. Hata hiyo picha niko nayo hapa, hii alikuwa akisoma hiyo shule, sikuwa naweza kutambua kama hiyo ugonjwa kinatambulika kuwa Kenyatta. Basi kutokea hapo Nuria sasa ako tu kila kitu ni mimi namfanyia. Hata akiwa kwa hedhi mimi mwenyewe ndio nifue, ajijui ni nini mpaka kuulize mama, naona damu. Sasa mimi nashtuka, mwenyewe namtengeneza. Sasa huyu mtoto vile vile hawezi kuenda kwa choo. Kuna choo yake pale mtaiona yenye anakalianga, kuna ndoo chini. Nilisaidiwa mahali alikuwa anaenda huku Light in the Hope. Kasaidiwa choo ndio anakalianga hapa ndani ya nyumba, hawezi kuenda kwa choo hizi zingine. Naye mwili wake unadhoofika, akui. Hata maumbile yake ukimuona saa hizo unaweza fikiri mtoto na miaka 10, akui. Ni kurudi tu chini, hata na maumbile yake sio kisawa sawa. Mwanzo mimi watoto walikuwa wanafura mikono, watoto wanafura shafu, macho, mpaka miguu, tumbo. Nikipeleka hospitali wanapima ni malaria kidogo, hata sio mtoto anafariki na sikuwa najua. Sasa mtoto niseme mtoto wa 6, marehemu Fatuma ndio nilijua kama amepelekwa hospitali, na wazungu walinisaidia kumpeleka hospitali. Sasa ndio wakapima wakasema yeye ako na sickle cell anemia. Na mimi hata sikuwa naelewa sickle cell ni nini. Basi huyo sasa akatibiwa, akakaa, alikufa akiwa na miaka 12. Sasa hao wengine walikuwa nikipeleka hospitali wanasema tu ni malaria. Sasa walikuwa akikaa ndesa vile niliona hiyo rangi yenye naona Nuria ako nayo, walikuwa akiwa nayo. Sasa ndio nikimejua sasa kumbe hiyo ugonjwa ndio ilikuwa inanyonya watoto wakikufa kama sijui. Sasa hata nilimbadilisha huku nikampeleka kwingine kule Dandora. Sasa ndio anaendanga kukaa, yani tuone kama atapata usaidizi, yani badala ya kukaa hapa peke yake huwa nampeleka kule. Lakini bado sijapata usaidizi wake ate mama aende apelekwe shule mahali kama watoto wengine. Ni kwenda tu kukaa mahali ya pewe chakula na kufundishwa kunawa hivyo vidogo vya mkono. Mimi matumaini yangu kwa Nuria, najua Nuria atapona kwa sababu mahali amefika ana nguvu kuliko wanadamu. Kwa sababu bila Mungu mwanadamu hawezi pona. Na mimi nashukuru Nuria amefikisha hiyo miaka, naona Nuria tumaini yangu kwamba Nuria ataishi na ataishi kama watoto wengine.
Have you ever wondered why our red blood cells are in a circular shape, or rather what would happen if they take another shape? Well, today in Health Matters, we're going to inform you on blood disorders, especially the common one, sickle cell anemia.
Sickle cell anemia is an inherited condition, or somebody, in other words, is born with. And it really affects the red cells. The red cell shape is changed into the shape of a sickle. That's why it's called sickle cell anemia. Sickle shape is like a new moon. Okay. And the actual abnormality is in the molecule called hemoglobin. The hemoglobin molecule is the one that carries oxygen from the lungs when we breathe in to our tissues and then brings back carbon dioxide to the lungs. So when we breathe out the carbon dioxide. So there's an abnormality in that molecule, the hemoglobin molecule. And the abnormality is only a change of one amino acid. Just one amino acid has made the difference to change the shape from round, or what we call discoid shape for the normal red cells that you and I have, to the sickle shape of the people with sickle cell anemia.
Okay, and what causes sickle cell anemia?
Well, it's really a genetic abnormality, mutation. You see, in our cells we have nucleus, and in the nucleus we have proteins. Now sometimes those proteins, because of either radiation or chemicals, they can change. One of the proteins can be changed. It can be changed anew, or if somebody has a parent who has sickle cell anemia, then they will inherit it. Sometimes it's not one parent who has it, but two parents can be just carriers. They themselves don't have the problem, but because they are carrying that gene, then they pass. When the gene from the father and the one from the mother, they combine, then in one child, then the child gets it. The parents could be quite fine, but you may find that both of the parents may have relatives who suffered that condition. So it's either that you inherit it from one or two parents, or during the formation, when the baby is being formed in the mother's womb, a chemical or some radiation may injure or change one of the proteins, and therefore the child then gets born with sickle cell anemia. So that's what causes it, really.
Okay, and what are the early signs of sickle cell? Okay.
The early signs usually come for most babies when they are 6 months old. And the first and typical sign is that they end up with swollen arms and swollen feet, really swollen and very painful. So the child is crying, and the mother doesn't understand. But when you look, you'll find both hands and feet are swollen. It's one of the crises that these people with patients with sickle cell anemia get it. They get many different crises, so this is one of the first crises that usually they get. So it's usually diagnosed around 6 months of age.
Okay, and do they live past a certain age, or do they have an age limit?
I would say, alhamdulillah, now with improvement in medicine and medical care, they actually live, like I think the eldest we have is over 40. But when I was still starting my career, medical career, they didn't used to live beyond their teenage. So around 14, 15, they would pass on. But with improved care, with better medication, we are able now to push them at least to beyond 40. And therefore they can also have children now, whereas before it wasn't easy for them to do that.
Okay, and you've talked about carriers. Let's say if the mother is a carrier and the father is not a carrier, can it affect the child?
No, because for you to get the disease, you need to be able to get the gene from both parents, if you are inheriting it, because it's what we call a recessive gene. To put it simply, it's a weak gene. On its own, if you just get it from one parent, you will also end up being a carrier. But if you get the carrier state from the mother and from the father, then together, the carrier two states, then now the disease will manifest itself.
Okay. And how can the parents know they are the carriers?
Oh, there are blood tests that can be done that can show that they are carriers. It's a simple blood test that can be done to prove that you are a carrier, as well as to the ones who also have the disease. We also have to do a blood test to prove that they actually have this disease and not any other disease. So there are specific tests that we do to diagnose sickle cell anemia.
Okay, that happens before the mother gets pregnant. It's when you get both parents to get tested, or
ideally,
do you advise them?
Ideally, that is the best time to do it. To do the test before they get married so that they know and they can be counseled that since both of you are carriers, then there's a likelihood of your children getting this disease. And the likelihood, well, it's really a matter of like a gamble. According to science, when two parents are carriers, then the likelihood of the children getting it is 1 out of 4. Like 25% of the children would end up having the disease. But that's really more of science that we do in books. Finally, when this couple do have children, it doesn't always end up like that. They may end up with 3 children and all 3 children get the disease, as has happened before, or get 4 children and none of the children get it. But ideally it's supposed to be 1 in 4 according to the books that we read.
Okay, and apart from counseling, are there medication they can use? Is there any way to prevent the children to get the disease?
Not really. Once you have inherited that gene, you have it with you. How to prevent the children from getting it? It's really beyond science right now. At the moment, we really don't have a way of preventing passing on of genes. It's like the way maybe you have your mother's eyes or your father's nose. It's not very easy to prevent that happening. But once we know, once the parents know, and when now they have a child and they see that the child is not doing well, then we'll have counseled them. Bring the child to hospital. Let's test the child to find out, is the child a carrier? Is the child having the disease? Once they have the disease, like I said, at least now medical care and management has improved. We're able to make them live beyond 40. Okay, there are few scientists in the world who are trying to do bone marrow transplant. That's one way of getting the child not to get the disease and not to suffer, to send them for a bone marrow transplant. But as we speak, it's really more of a lot of research. We've not had so many of them getting the bone marrow transplant and living for so long for us to say, yes, it's working, yes, it's helping them. So we are still sort of watching and seeing to see how they will progress. And the problem, of course, of bone marrow transplants is it's not available in Kenya.
And can blood transfusion help in certain scenarios? Like
actually, these patients are highly dependent on blood transfusion. One way of helping them is sometimes to even hyper or over transfuse them, so that the sickle cell blood that they have percentage is reduced, and then the normal blood, because usually the blood transfusion comes from a person who is normal and doesn't have sickle cell, and so that the percentage of normal blood increases. But that's usually a temporary measure, because blood in the body, these red cells, only last about 120 days. So that's part of it, and in between we have to transfuse them, because what happens is, because of that abnormal shape, these cells cannot go through the small blood vessels in the body, at the end of the hands, the feet, the toes, and other parts of the body. So when they end up in those small blood vessels, they get stuck. When they get stuck, then the immune system recognizes them and destroys them. So the red cells of people with sickle cell anemia are destroyed faster than yours and mine. Much shorter. I said normally it's 120 days. For them it can even be 50, 60 days. So they actually end up with a lot of anemia. They usually live with an anemic situation most of the time. The body sort of adjusts, but in between, when that anemia becomes very severe, then they have to have transfusions.
Okay, and you've said before, the signs start at 6 months, let's say. Can it start later than 6 months?
For some of them, yes. Some of them will present later than 6 months. In fact, we've seen this, that even in the same family, 2 children who have gotten the sickle cell, one may present at 6 months, the other one might present even at the age of 3 years later. So there are also other things in the body that help to modify the presentation of this disease, how soon it prevents, and also even how severe. One child may have a very severe condition, while the other one, his is mild. Yeah. What helps to modify this condition is the presence of another hemoglobin called the fetal hemoglobin. The fetal hemoglobin we all have when an individual is in the mother's womb. That is the hemoglobin that helps them to be able to transfer oxygen and carbon dioxide. But what happens in normal people, after they've been born, the level of fetal hemoglobin gradually reduces until by the age of 6 months, it's almost non-detectable. Yeah. And so that's why they usually will present at 6 months. But what happens in the individual with sickle cell, this level of fetal hemoglobin does not completely go down. It actually remains in their body for the rest of their life. And that's really what keeps them alive, many of them. So the higher they have concentration of the fetal hemoglobin, the less severe the disease is. And the lower concentration of this fetal hemoglobin, the more severe their condition is.
And does sickle cell anemia mimic any other disease or any other condition?
Mimicking, not really, because it's a disease on its own with its own features, which we haven't gone into. It has its own features, but there's a similar, another disease, actually quite different, though still affecting the hemoglobin molecule in our body called thalassemia, that resembles the way they present. So when you see two patients, one with thalassemia and the other one with sickle cell, initially if you don't know where they come from and you haven't talked to them, you may think they both have the same condition. But thalassemia is slightly different in the way, in its abnormality. Instead of affecting one amino acid in the hemoglobin molecule, it's actually the number of amino acids that are being produced for the hemoglobin. See, the hemoglobin is a huge molecule. It has 2 alpha chains of amino acids and 2 beta chains. So in thalassemia, and you have to have 2 of them, equal ratios. In thalassemia, the beta hemoglobin, the production of beta hemoglobin is markedly reduced. So there is not enough beta hemoglobin to match up with the alpha hemoglobin. So still in the hemoglobin molecule, but you see the abnormality is completely different. But the way they present is the same. They're both anemic, and because their blood is destroyed faster than normal, they also have jaundice, the yellowness of the eyes. They don't grow as well as normal children. They're usually very thin. They don't put on weight so easily. And then their bone marrow is always hyperactive, and therefore you'll find that their foreheads are a little protruded. And then because of this frequent and frequent destruction of these sickle cells, then even their spleen gets overworked until it even undergoes self-destruction. So initially they do have large spleens, so they have protruding bellies, but later on the spleen goes very, very quiescent. And therefore, because of that, they are also very prone to certain infections like pneumonia, meningitis. Those are very, very common infections that they frequently get because their spleen is not able to protect them against those infections that are caused by capsulated organisms.
Okay. And you've mentioned something about features of sickle cell anemia.
Yeah.
What are those features?
The features are those. First of all, the baby gets, or the child gets frequent crisis. There are different types of crises. There's the hemolytic crisis, where now their blood cells are destroyed so frequently and so remarkably that the blood goes down and they have to have a transfusion. Then they have a painful crisis. They will come with severe pain at any part of the body. And this time it will be maybe the one shoulder, next time it might be the leg, another time it will be the tummy. That's a painful crisis. And many, many other crises. So they are frequently falling sick. And because they frequently fall sick, if it's a school-going child, they don't go to school as much as they should. They keep missing school. And because of the reduction in the hemoglobin, they don't grow the way we expect normal children to grow. Weight for weight, they are lighter, and even their development, you'll see it's slightly different. And then the other feature, is, as I mentioned, is the yellowness of the eyes. Frequently, you see them walking around with yellowness of eyes, or most of the times. It might change from being mild to severe yellow, but usually they have that yellowness of the eyes. And then because they're anemic, when they do a little exercise, they get breathless. So they can't do heavy labor. And during cold weather like this, they're also not very well. They really have to protect themselves from the cold weather because it also gives them more frequent crises. So those are the features of sickle cell. And they resemble the features of people with thalassemia. But the difference is that sickle cell is mostly found in Africa, especially in the tropical belt. So all the way from East Africa to West Africa. A little bit around the Mediterranean Sea and a bit in Saudi Arabia. But of course, because of migration of people and the slave trade, we also have a big population in North and South America. The African Americans also have sickle cell. Whereas thalassemia is found around the Mediterranean, Middle East, and the rest of the Asian continent.
And can a person have both thalassemia and sickle cell anemia?
Yes, unfortunately it can happen. If one parent comes from an area that has thalassemia and he's a thalassemia carrier, and the other parent is coming from an area of sickle cell, yes, we do get some individuals with both sickle cell as well as thalassemia.
And how do you diagnose that?
The diagnosis we make from a blood test. We take the blood and we break down the red cells, and then we look for that. The sickle cell disease, the hemoglobin of the people with sickle cell is called hemoglobin S. So we have a way of identifying that hemoglobin S. We have the electrophoretic way we use. It moves, when you give it an electric current, it moves slower than the normal hemoglobin. But there are also, of course, the molecular way of diagnosing it, where you now go to the actual hemoglobin molecule and look for that amino acid that has been changed.
Oh, okay. And does it affect the skin in any way, the sickle cell anemia?
Skin?
Yes.
Not really. The skin isn't really affected. What is usually affected is that if they end up with an ulcer, then they have chronic ulcers. The ulcers don't heal, or they take forever to heal. They can take years to heal. But the reason isn't because of the skin per se, it's because the blood supply is affected. As I told you, because of these cells being sickled, they don't move as quickly and as smoothly in the small blood vessels. And now under the skin, that's where you get the smallest and tiniest blood vessels. And so because of the slow movement of the blood, the slow supply of oxygen, the slow supply of nutrients. So, and you know, for a wound to heal, it needs all this at much higher concentration than other areas of the body.
And which organs tend to get more affected with sickle cell anemia?
Which organs get affected? Really, all organs get affected because the blood moves through all the organs of the body. And because the blood moves through all the organs, it carries these sickled red cells through all the organs of the body. So the one that maybe you could say gets affected most, you'll find is the areas like the spleen that I mentioned, because they end up with ischemic crisis. This is where now the oxygen supply to the spleen is so reduced that part of the spleen dies. So, and then the next time that happens, another part dies, and so on and so forth until the whole spleen ends up actually dying on its own. So you could say that the spleen is the one most affected, but it's sort of an indirect way. Otherwise, blood flows through all parts of and all organs, and therefore all organs get affected.
Okay, and is it divided into stages?
Sickle cell? Not really, but what we do divide it into is the presentation. Like I said, some children will have a mild presentation, others will have a moderate presentation, and then the others will have very severe presentation. And the difference will be those with very severe will have to be admitted several times a year, whereas those who have mild, they may go a year or two before admission, because the number of crises and the severity of the crisis varies with the severity of the condition.
Okay, and can a person die from it?
Can a person die from sickle cell? Not sickle cell itself, but from the complications of sickle cell. So sickle cell has all these complications. I mentioned they are very susceptible to infections with capsulated bacteria. So sometimes when they get one of those infections, whether it's meningitis or pneumonia, if it is not managed well and quickly, then that could be a cause of death. Okay, or if they have the sickling crisis, or hemolytic crisis, where the blood goes down so low that maybe they are in a small hospital and maybe somebody is not able to diagnose. By the time they're diagnosed and transferred to the nearest larger hospital, that the heart has begun to be affected in the other organs because of the low hemoglobin, that could be a cause of death, the anemia. So it's really the complications that can lead to death. And that's why we have to counsel these patients as well as their parents, because initially when they come, they are still children. We counsel their parents and we tell them what things to look out for, how to protect their children, and what medication they need to take. There are some medication they need to take up to the age of 21, and there are some that they need to take actually their whole life. And as long as they take that medication, it helps them at least have a relatively normal life, and they can, go to school, get a job, work, and they can have a relatively normal life as long as they know how to take care of themselves.
Okay, and since it's a blood disorder, is it more prone to certain types of blood groups? Like, let's say blood group O is more prone to get sickle cell than blood group A?
Not really, not really. What we have seen is very common in these patients. Let's look at Kenya, for example. We've seen that people who get sickle cell are people also who seem to live in malaria endemic zones. Those areas that have severe malaria. So we are talking about people living around Lake Victoria and people living around the Indian Ocean. That is where we have severe malaria. And this seems to be the environment that a lot of these people are in. And therefore, when you look at those people living around the coast and around the lake, you find them with different blood groups. It has no relationship to the blood group. You see, the blood group is a protein found on the surface of the red cell, whereas sickle cell is the protein in the hemoglobin, which is inside the red blood cell. So they are very different, and there really isn't a relationship. The only relationship is that the malaria endemic areas, so all the people living there are usually very, so that when you go to areas like we call, for example, the former Central Province, it's not very common to get person with sickle cell, unless they have intermarried with somebody from the coast or somebody from living or coming from around the lake.
Oh, okay. And does it anyway cause infertility? Is there a relationship between it and
not? Absolutely not. It does not cause infertility, except for the fact that, for example, if somebody has sickle cell and they have the very severe type and they are continuously and frequently sick, then it's not very easy for them to conceive. But if they are not very sick, though they can still conceive in between when they are not sick. So actually, there isn't a relationship between sickle cell and infertility. If you look at all the people who are infertile, you will not find that a good majority of them have sickle cell. Yeah. So we do have people with severe sickle cell who have actually given birth to children. We do have them. They can conceive and they can get children. Only, of course, now their children, they will pass it on to their children, as you've understood, as we realize. Yeah.
So maybe you could just give us your last words, the advice to newlyweds, to parents, and to anyone out there who has sickle cell anemia.
The advice I would give is, if you have family members who have this condition, before you get married, it's good to go for this test, so that both the couple have the test together. You won't discriminate, so that they can find out, are they carriers of this condition, if there is family history, or if they happen to come from these areas I mentioned, around Lake Victoria and from the Coast Province, the former Coast Province, then it would be good for them to do the test, so that if they are found to be carriers, then they can be counseled, they can be explained what is it, how do they manage it, in case they get a child with sickle cell, how will they take care of that child. And with good care, the child should be able to live to an ripe or adult age. And I think as we improve the medical care, we'll be able to push this age to 50, 60, and so they can be able to live a full productive life. So it isn't something one needs to be afraid of. It is something that one needs to be aware of beforehand, so that when finally that you are told your child does have sickle cell, it doesn't give you a heart attack.
Thank you so much for your time.
You're welcome.
I hope you're enlightened by our show today. And for Health Matters, I have been your host, Naima Abdullah Hab.